has no logo on it, neither HelpAge nor the minister. The ministry. Wait.
You don't have no logo with information behind it? How is me?
I said the logo.
I'm just a messenger. Don't shoot me.
Good day and welcome once again to the afternoon update here at the Government Information Service. We are coming to you live, the Information Command Center. It's a brand new week as we welcome you, our listeners and viewers, for regular updates regarding government's response to COVID-19, as well as measures being undertaken on our way to recovery. We are on NTN as well as the Government of St. Lucia's Facebook page and YouTube, and we are joined regularly by WVNT 93.5 FM. Today is being observed as World Elder Abuse Awareness Day, and we have two very special in-studio guests with us. We will be joined by them a little later on, but first, our regular updates. Yesterday, June 14th, was observed as World Blood Donor Day. And one donation can save up to 3 lives. Find your inner hero and make an appointment with the blood bank, as you never know whose life you may be saving when you donate blood. We have a video from the Bureau of Health Education.
What's going on there? You can still give blood in this COVID time.
How you mean, Brandy? COVID preventing people from giving blood? No, my girl, you can still give blood. In fact, blood is needed now more than ever with this COVID-19 pandemic.
Really?
Yes, my girl. Every 5 minutes, someone needs blood.
You joking? Every 5 minutes?
Every 5 minutes. Think of all the accidents, fights, persons needing surgery, have diabetes, hypertension, kidney disease, and cancer in St. Lucia. All these people need blood.
Yes, you never really realize how blood helps people and how much is needed.
True. You know 1 pint of blood can save 3 lives?
So you tell me that if I give blood there now, I can save 3 people?
Yes, it could even be someone you know personally. The way things are in this world, you never know. One day you're there and the next.
But I have a tattoo and I even have my period.
Don't worry about that. 1 year after you put the tattoo, you can still give blood. And even if you have your period, we check your blood levels before we even start the donation process.
Okay, that sounds good. I would like to tell my friends and family to give blood. Do they just come to the hospital?
No, they don't. They should call to make an appointment. Because of COVID-19, we have to maintain physical distancing and the number of persons waiting. You can call to make an appointment with the St. Lucia Blood Bank Service at 4525-430 or 285-9642, and not forgetting in the south at 459-6758.
Okay, thanks. Let's go. I want to give blood now.
A very important message there from the Bureau of Health Education on the importance of donating blood. Continuing with our updates, as of today, Monday, June 15, the curfew time has been decreased. The amendments to the Emergency Powers Order came into effect from today, Monday, June 15, 2020, and are as follows. The curfew hours are adjusted to now start from 12 a.m. midnight to 5 a.m. each day. A person may host or attend social activities, parties, picnics, weddings, receptions, banquets, in keeping with the established physical distancing and other public health protocols. However, mass crowd events, sporting tournaments, and contact sporting events remain restricted social activities. A person with a valid liquor license may expose for sale or dispose of intoxicating liquor in accordance with the Liquor License Act, Cap 13.17. We're now taking the latest update from St. Lucia's Chief Medical Officer, Dr. Sharon Belma George.
As of June 14, 2020, the World Health Organization reported a total of 7,690,708 confirmed cases of COVID-19 globally, with 427,630 deaths. Within the region of the Americas, there was a total of 3,711,768 cases. As of June 15, 2020, St. Lucia recorded a total of 19 confirmed cases of COVID-19. 18 of those cases have fully recovered. The last case was a repatriated cruise national and was recorded on June 4, 2020. Testing results received on the weekend indicated 44 negative test results. A total of 1,356 tests have been carried out to date. Effective June 15, 2020, the curfew is imposed from 12 a.m. to 5 a.m. each day. Also, some social activities, including parties, picnics, and receptions, are allowed with the established physical distancing and public health protocol. The Ministry of Health and Wellness alerts the public that as we open up the sectors, the risk of transmission increases. We can reduce this by ensuring the public health and social measures are maintained. We also anticipate new cases. However, if we all comply by the guidelines and maintain them, the possibility for transmission is minimized. One of the recommendations included the use of a face mask or scarf when going to public places such as the supermarkets. The face mask or scarf may be used for source control by reducing potential exposure risk from infected persons during the pre-symptomatic period. The mask is needed for use when someone is less than 6 feet from others, as in the supermarket and other stores, and in such situations. The prolonged use of the mask does not cause carbon dioxide intoxication nor oxygen deficiency. Face masks should not be used in the following situations, that is, driving a car, especially if you are alone or with immediate family, riding a bicycle or motorcycle, walking on the street when alone with no one near, during exercise or gym or running, with family members or group of friends when seated at a restaurant. Also, students who are seated 6 feet apart can remove the mask during class time. Wearing a face mask is complementary. It does not replace the recommended preventative measures. So as usual, we ask that everyone continues to sanitize their hands by either using hand washing or an alcohol-based hand sanitizer. Also, to wear your mask during daily activities when you're out, maintain the 6-foot distance. Also be sure to cover your mouth and nose when coughing and sneezing. These simple and inexpensive actions will make a meaningful difference in preventing the spread of infection. As always, the Ministry of Health and Wellness will continue to provide regular COVID-19 updates as received.
And that was the latest update there from our Chief Medical Officer, Dr. Sharon Belma George. We also see the reopening of the Sulphur Springs Park Monday, June 15. According to the Sufra Regional Development Foundation, the public is advised of the reopening of the Sulphur Springs Park. Operational hours have been initially set to 6 a.m. to 8 p.m. daily, with the probability of extension based on the relaxing of time restrictions on the prevailing curfew. The organization further advises that patrons strictly adhere to all health and safety protocols established at the park in order to mitigate any potential spread of COVID-19 and other infectious disease. And for our final update, the government of St. Lucia is continuing to innovate and reimagine COVID-19 relief efforts as the Good Food Boxes initiative was launched on Wednesday, June 10, 2020. Every week, approximately 1,000 families will benefit from over 6,000 pounds of locally grown and sourced food packages, which will be distributed as part of the government's National Meal Program. We take in this report.
"1,000 boxes of locally grown produce will be delivered on a weekly basis to persons on the National Impoverished List as part of the National Meals Program. The government of St. Lucia has continued to innovate and reimagine relief efforts as the Good Food Boxes initiative was launched on Wednesday, June 10, 2020. This program will not only serve as a wholesome option to feed households, but also function as a new supply outlet for farmers who have been displaced due to the COVID-19 pandemic. Prime Minister Honorable Alan Shastney stopped by on Wednesday to encourage the team and to be part of the process.
Very excited because today is the continuation of our feeding program, the COVID recovery, social stabilization program. As you know, we've been doing hot meals, and now we're going into where we're doing boxes, which will go to now households. So we're looking to do about 1,000 households to begin with, and on average there's 4 or 5 people in a household, and then we're trying to grow that number. So for the next couple of weeks we'll do the 1,000 and continue to grow from that point. But I think this is a very effective way to be able to help people at this very difficult time.
Assistant Manager of the Marketing Board, Teresa Daisy, spoke to the benefits to farmers and fishermen and how this program will allow thousands of pounds of locally grown produce to be purchased and distributed island-wide, providing a new weekly market.
The fact that we have 1,000 packages to prepare on a weekly basis, on an average, I would say the minimum that we buy from any item is 6,000 pounds weekly. And that in itself is quite a large number, given that we have 1,000 boxes to prepare every week. We have been purchasing from our farmer groups as namely Angers, Saltibus, Buns, Grace, and we have individual farmers who are coming in to drop whatever produce that they have on the ground right now. In the packages we have produce like plantain, ripe banana, pumpkin, cantaloupe, honeydew, tomatoes, and we have added some more stuff from the imported side, which are garlic, onions, and potatoes.
Farmers came throughout the morning to drop off fresh food.
I supply 1,000 livres bananes pour marketing board, yon y a projet côté yo ka soin ces gens cette Lucia. Moi crois que ça c'est une bonne initiative. Farmer ka produit tous les jours. Et ça ka encourager pharmacie yon market pour ça produit plus. Moi crois programme ça là c'est un bail qui ne peut continuer because si marketing board ça consolidé, gagne marchandise from toute pharmacie cette Lucia. Et que yo même quand ils vendent pour le public, yo quand ils vendent by hôtel et tout partout, yo ça juste exporter en la région. Mais si moi ça vend plus, moi quand ça produit plus. So moi quand encourager initiative ça là.
This program falls under a broader mandate by the government of St. Lucia called the Social Stabilization Plan. This plan, as announced by the Prime Minister, seeks to bring relief to St. Lucians who have been impacted by the ongoing pandemic. This Good Food initiative brings relief to families and farmers and will continue for several months.
I think that this is a win-win situation that we have. So a win situation for the more vulnerable families in our communities. I mean, as you know, we have the vulnerable list. And what we found with the hot meals is that it was really going to one person or only 2 people in a household. And so the transition now into these boxes where they can prepare their own meals is also a win situation for the farmers. And that we're able to now help the farmers who've lost a significant market because of persons' incomes being less, but also because the hotels are closed. And then for the government, certainly being able to get great value for the money that we're putting into this, it's able to help substantially more people than the way that we were doing it initially. I think the initial way was important, but as time has gone by and the team has continued to review the situation, we think that this is going to be the most effective way for the next couple of months.
Farmers who are interested in supplying produce are asked to contact the St. Lucia Marketing Board. Reporting for the Office of the Prime Minister, I am Danielle Dubois.
And it is quite noteworthy to hear that this initiative will also serve as a new supply outlet for farmers who have been displaced due to COVID-19. We take our first break, and when we come back, we'll be joined in studio by our guests. So stay tuned.
As part of government's social stabilization plan to assist persons who have lost their means of earning due to the COVID-19 pandemic, the government of St. Lucia has implemented the Income Support Program, where non-contributors to the NIC shall receive a monthly payment of $500 for the next 3 months. Taxi drivers, jet ski operators, vendors, agro-processors, tour guides, hairdressers, barbers, small bar and restaurant operators, construction workers, and other sole traders who meet the criteria can apply using the Government of St. Lucia's website www.govt.lc. Payments will be made directly via electronic transfer to the recipient's bank account. The Income Support Program, simple strides towards recovery.
And welcome back. In studio with me today is Ms. Andrea Alcid, a family caseworker with responsibility for the elderly at the Division of Human Services, and Ms. Helen Charles, Executive Director of HelpAge St. Lucia, National Council of and for Older Persons. Welcome to both of you.
Thank you very much.
Thank you very much.
And today we'll be talking about elder care in St. Lucia as we join the rest of the world in observing World Elder Abuse Awareness Day. The UN Secretary General Ban Ki-moon said, and I quote, "I call upon governments and all concerned actors to design and carry out more effective prevention strategies and stronger laws and policies to address all aspects of elder abuse. Let us work together to optimize the living conditions for older persons and enable them to make the greatest possible contribution to our world." End quote. Before we go into the meat of the matter today, maybe our guests can start by telling us about the various departments, agencies, and how it impacts on providing a better quality of life for our elder persons. Ms. Charles?
Good afternoon. As our moderator has indicated, I'm the Executive Director for HelpAge. Been working with this organization for the past 13 years in different capacities. One of the things that we have done over the years is to ensure that older persons participating in whatever that is happening in the country. We don't want to leave them behind because most times when older persons or persons reach 50 or 55, some of us are saying it is time for us to go home and die. But one of the things that we are doing at HelpAge, we make sure that those persons participate in different activities. And over the years, we had senior games. We have the golden pageant is to get older persons to make sure that they keep healthy and they participating in sports to make sure that their health in order. And another thing that we do, we have different club 60s around the island, and we also have different groups. For instance, we have human concerns, diabetic and hypertensive in different communities. We work with the health centers. We work with individuals because you find we have an adult daycare center where we bring in older persons in the morning and they go home at night, is to make sure that they meet with their peers and to enjoy their lives. And one of the things that we do at the daycare center, we have things like craft, arts, and you name it. And we make sure that they do whatever that they want to do. For instance, when they come to the daycare center, they decide, look, today I'm not doing anything. We allow them to do that because they have rights, and we make sure that they exercise their rights as much as possible. We also work with the different homes around the island, like the Marian Home, St. Lucy's Home, for our show, the Mother Teresa Home, Comfort Bay. We work with the different homes and to ensure that older persons are being taken care of. One of the things that we have done over the years is, unfortunately, we do not have a policy that guides older persons, but we're working on it. And we're working with the Human Services. We have 2 case workers. We have Miss Alcide. As soon as you call on Miss Alcide will be there. We also have Miss Andrea from Viewford. These 2 people, sometimes I think they work magic, especially Miss Alcide, she work magic. And it is for this reason that I feel confident that things will change. The prevention of elderly abuse, I mean, over the years, you find a lot of older person has been abused, but with the program, the NICE program, they had the NICE program before, now they have, government have the home caregivers. Elderly abuse has been decreased to some certain extent. But elderly abuse is something that is decreasing in one way, but increasing in another way. Because sometimes what we take for granted, the type of words that we use for the elderly, it's some sort of abuse. And sometimes we abuse our elderly, we're not even aware of that. And this is some of the things we need to talk about. I will pass on to Ms. Alcide, so she will break it down in a better term.
The magician, the
miracle worker. Because to really speak the truth, she's a very hard-working individual. For the short space of time that I've been working with her, she has worked magic for older persons.
Ms. Alcide, tell us a little more about your role.
Okay, my role within the Division of Human Services as family case worker for the elderly, there are 2 of us. There's myself and Miss Andrew in the southern area. Our division is really, our department rather, is a new department. It's about 18 months, not 2 years yet, with very limited resources. So like Mrs. Charles mentioned before, we collaborate. We work with the police, we work with the SSDS home keepers, we work with Miss Charles a lot because she's been in that business for a very long time, so she knows what to do, how to do it, and who to go to. So we try our best to collaborate with any and everyone with some type of measure or who can assist us with ensuring that the well-being of the elderly is met. So this is what she means by we are there whenever she calls on us. So we try our best to ensure that we can do any and everything, not working in isolation, but with the older persons to make sure that they're comfortable and their well-being is being met.
And as we observe World Elder Abuse Awareness Day, today, June 15, what is the overriding message that your department would like to put out there?
Okay, the overall message that we would like to put out there as a department is no one person is supposed to be left out. We all as a community, as a nation, as a world, let's come together, let's do what we can to stop elder abuse. Because elder abuse can be the simplest thing as mismanagement of medication, not providing an older person their medication. That's abuse. So let's try our best to remember the elderly, to do what we can for them to make sure that they're not abused in any way whatsoever.
Okay, so could you go into a little bit of more detail as to how do we define elder abuse? How do we become more aware as to what is elder abuse?
Well, elder abuse is really any lack or any action that is taken against an older person that will in any way infringe on their well-being, on their rights. It is showering an elderly with or an older person with extremely hot water. It's giving them too less an amount of food to eat. It's, again, not giving them their medication. It is leaving them in the house alone for a whole day unattended without their meals. It is misuse of their financial resources. So say, for instance, an older person is receiving public assistance or what we call welfare. You collect it for them, yet you do not spend it on their basic needs. That is considered as abuse. So all of those things. Or if you caring for an older person, be it as a family member or a caregiver, or you've been paid to care for that older person, if you handle them too rough when taking them to the shower, putting them to sit down or stand up, that is constituted as abuse. So we want persons to recognize the little things that can be deemed as an abusive action towards the elderly and stop it and be very cautious, understand that, hey, I will treat this older person just as I would like to be treated myself when I get older.
Ms. Charles, it is said that in many parts of the world that elder abuse occurs with little recognition or response. How would you describe what obtains here in St. Lucia?
What obtains in St. Lucia, I think some of us, we are not aware, or maybe we do not understand what elderly abuse is all about. For instance, neglecting, allowing our elderly to, the clothing is not proper. For instance, it's not clean. Personal hygiene is one of neglect. They're living in homes that are fire hazard to their health. The homes where they live, there is no electricity, there is no running water. This is a form of abuse. That is what you call neglect. And sometimes you find a lot of older persons live in this type of conditions. And what we are doing at HelpAge, our organization, is to ensure that older persons, those that we know, and because what we have, as I said, we have Club 60 and we have other clubs, those that are reported to us, one of the things that we do is to make sure that if they need house repaired, the house need repairs, we do that. We work in collaboration with the sewage, the water and sewage authority, so we can get not free water, but at least the $24 every month, or sometimes they give them free water. And also electricity services, where they give them a line and they pay minimum electricity. It's not really free, but these are some of the things that we make sure that happens to older person. As a matter of fact, we have 2 cases. We just in the process of making sure that these 2 people homes are being repaired, because as Ms. Arsid and myself, we're working, and also Ms. Andrew, we're working on ensuring that these things, right, are taken care of. Their well-being are taken care of. It is true that government is giving them the public assistance, but we're not leaving everything for government to do. We make sure, because one of the things we're trying to do is to get the community to be responsible for the elderly. Because most times we do things in isolation and it doesn't work most times. So what we're trying to do is to get everybody involved, get the community involved, and maybe if we're doing a house repair, they can give a sheet of plywood to ensure maybe somebody that lives next door can say, okay, you can get some water free and these things, because this is some of the things that
going back to the Kudme spirit,
right,
the community.
Right, exactly. And also the business places, because these are the people that when you go to them, they're always willing to help, right? And this is what the PAHO is saying, and also the World Health Organization is encouraging, and also HelpAge International, because the HelpAge, the headquarters is in England, they're advocating on behalf of older persons to make sure that their rights, they know their rights, and make sure that we give them what is due to them, because they're the foundation of our country, and we need to give them in the twilight years to make sure that they are comfortable as much as possible.
You mentioned earlier on some of the social activities that you would engage in with the elder persons in terms of not letting them just be in a corner, that sort of thing. Naturally, with COVID-19, that have hampered some of those social activities. What has been your response in trying to mitigate and still trying to engage them in one way or the other?
As a matter of fact, this year we had Senior Games, and Senior Games was on hold for a little while. But last year we started, and this year it was going to be bigger and better. We had all our teams there. We also, every year we have the golden pageant, as I said. All that was in place. We had 7 ladies ready. Last year we had 5, but this year we were going to have 7 young ladies. And every time we have this show, especially the golden pageant, we have in the full support of St. Lucian's public. And also the elderly, they come and they enjoy themselves. As a matter of fact, some of them do better than the young people themselves. And one of the things that we have done in the past, older person has fly the world over. We have taken them to as far as San Francisco. We went to Utah, where we had 5 persons who took part in Utah. And the amazing thing about that whole process of things is when you go to these countries and you hear St. Lucia name being announced that, you know, our elderly folks are taking part in the senior games. Utah is another corner of the United States. When you reach, you can't take plane to go there. You have to, when you reach in Las Vegas, you have to take the bus to go there. So you find our St. Lucia elderly, they have really gone far when it comes to advocate on their behalf, to ensure that they do not stay home and die. They take part in whatever activities that are there. And we had the government support, because every time we've been to those countries, the government usually help us. We went to Barbados, we went to Trinidad, because that is where the whole thing started. It was Barbados who started senior games. Then it came to St. Lucia, then Trinidad. And then from there, every year, up to now, we get information. They send in the information for us to come and take part in senior games in Utah. So it is something that I am really proud about, that our seniors are taking part in whatever activity that is available to them. Mm-hmm. And as long as you give them the opportunity, you might be surprised, because people always tell you, you're 90 years and you can't take part in these type of things. And sometimes you find the children themselves are saying that. But you might be surprised that when they go there, they do better than the youth themselves. Because we have a gentleman who went to Utah. He came back home, he was 60 years. He came back home with 13 gold medals, right? And also when we went to San Francisco, it was only 3 of us who went. And he came back home with 5 gold medals. So that is to show you we are doing very well.
Mm. And saying those negative things is part of the emotional abuse that we were speaking of, Andrea.
Yes, yes. Yeah, because if you've been left in isolation, if you've not been able to join in the activity, or to even discuss what's going on with your family, with your friends, with the community, then it will be, you know, a distress to you. It will be part of emotional abuse. So that's why we're trying our best. Say, for instance, Ms. Charles spoke about our senior games for this year and our other activities. Saying that we couldn't have the senior games, which last year was really exciting. We even had some guests from Dominica who took part. We're trying, or we're hopeful that next year we can go on, because like she said, we had our teams ready to go. We had the older persons ready to run and win their races. So we still try to keep in contact with the various group leaders to see, hey, what can we do when this pandemic or this situation subsides, to see how we can create something to have persons come together, especially those who are ready to go for the activities that we have. Because younger persons, they mentally affected by the situation of COVID, like our older persons, because they don't know what's going on. They don't, yes, they read the news, they hear what this neighbor have to say, they hear what Jukba have to say, but they want to know for sure, first-hand information, what's going on, what can I do, what can I not do. So that's all part of their emotional, well, I could say emotional abuse that they're suffering because of.
So therefore, going back to the whole world elder abuse and the awareness, what have you, would you say that this is a social problem? And if it is, how can we put it higher up on the agenda so that it becomes more apparent that this is a public health and societal problem?
It is. Like Ms. Charles spoke earlier, we're in the process of working on a policy. And hopefully when the policy has gone to Cabinet for legislation, then we can speak to legislative action when it comes to older persons being affected, being abused in one way or another. Because as we speak, yes, if you have a report of elder abuse in whatever form, shape or form, it's reported to the police, it's investigated, it's dealt with most times in the family court, and the magistrate would take it upon, his or her own as the ruler of the court to take action. But we're trying our best in the very near future to make that policy so there's no if, buts, or maybes. As long as there's the proof that this person is being abused, you will pay the penalty for whatever form or action that you've done against that older person.
Okay, and speaking of policy, the ministry responsibility for elder care is the Ministry for Equity, Social Justice, Local Government and Empowerment. The minister is Honorable Leonard Montoute, and we're now taking his message on World Elder Abuse Awareness Day.
Just imagine spending your life taking care of your family, working hard and making your contribution to society. You raise grandchildren as your own, everybody's needs you would meet, and whoever came to your door, make sure they got something good to eat. And then the time has come, you get old, and gradually people get so distant and cold. All the sacrifices you've made till you reach the end of your years, they're waiting for you to die, to shed their crocodile tears. Getting old is a privilege, so they say.
In 2006, the International Network for Prevention of Elder Abuse designated June 15th as World Elder Abuse Awareness Day. This is to raise awareness of the issue of abuse of the elderly and to find ways to challenge this behavior. This year, 2020, we celebrate this day with the theme, Lifting Up Voices to Create Awareness of Elder Abuse. The World Health Organization defines elder abuse as a single or repeated act of lack of appropriate action occurring within any relationship where there is an expectation of trust which causes distress to an older person. Implicit in this definition is a wide range of actions that are sometimes not considered as such, but which constitutes elder abuse. And so, I believe that it is important to understand so that it is recognized that elder abuse is not only physical, but rather it can be financial, verbal, sexual, and can involve the violation of rights to medical care and attention, jeering and name-calling, as well as discrimination which restricts their opportunities to participate in family and/or community activities. It can also invoke harm done to an older person by someone whom they know or have a relationship with, such as a spouse, family member, friend, or neighbor, and that it can be perpetrated by people who an elderly person relies on for assistance, such as staff at a nursing home and paid helpers or caregivers. Ladies and gentlemen, the aforementioned highlights that the fact that elder abuse can take a variety of forms, and I want to draw your attention to that central point and to emphasize the need to recognize it in all forms and to address it. Fellow St. Lucians, you may recall an incident in December 2019 when we heard reports of one of our very own esteemed persons, a lady of over 100 years, being brutally attacked and raped within the confines of her own home. While we all vehemently condemned the attack, it forcefully directs attention on the broader fundamental issue of elder abuse and begs the question of how many such situations are out there, undisclosed and unknown. How many of our older people continue to suffer unspeakable acts of violence, abuse, and neglect without a voice, without recourse, without someone to say stop? How many such situations are unreported and remain unattended to? Certainly, at the global level, the World Health Organization recognizes it as a serious social problem and continues to bring attention to the issue of elder abuse throughout the world. At the local level, we are also concerned about elder abuse and commit to addressing it in a comprehensive manner. Ladies and gentlemen, our current reality with the experience of COVID-19 and the economic, social, and psychological challenges anticipated will increase many stressors in the household and in society and may intensify existing risk for our nation's older people. I implore you, do not allow this situation to be a trigger for elder abuse. As families, communities, and governments try to cope with the new normal as a result of this pandemic, I take this opportunity to remind us all that as people, we must not forget our elderly, those people who have labored in the pursuit of raising families and building the economy of our country. As the world's population continues to age, and the same trend is recognizable in St. Lucia, the issues and challenges of elder abuse continues to be a source of concern and national priority for our government. The media population estimates of St. Lucia between 2015 to 2019 shows that 32 to 34% of the population is above the age of 45, putting them squarely in the category of older people. Last year alone, St. Lucia honored more than 30 centenarians, and it is our understanding that there were several more. Ladies and gentlemen, as I indicated previously, the government, through my ministry, is committed to supporting our older people and to ensuring appropriate programming in that regard. Through our public assistance program, many of our most vulnerable older people are provided with assistance in the form of a monthly cash transfer, health care, and where necessary, burial assistance. Our residential facility, the Comfort Bay Senior Citizens Home, prides itself in providing excellent care to the residents on a daily basis, and often the observation is made of vast improvements in individuals' health condition over time compared to when they were initially admitted. The government also provides subventions to residential facilities for the elderly, as well as organizations committed to working with and supporting our population of older people. Additionally, the SSDF's Home Caregivers program continues to give much-needed direct home care to many of our elderly, and we are committed to continuing this program. The Ministry of Health's Universal Health Care program also ensures access to medications for many older people, particularly the ones suffering from chronic illnesses such as diabetes and hypertension. Further, organizations such as HelpAge St. Lucia, Club 60 Groups, St. Vincent de Paul, and others continue to collaborate on projects and activities to provide relief and care to our elderly. I wish to acknowledge the efforts of the aforementioned and others, such as the Ministry of Youth Development and Sports, for their assistance with programs such as Senior Games, which helps to provide a platform for older people to showcase their talents and receive the honor and recognition they deserve. I also recognize and salute the many unsung heroes in the form of neighbors, family members, and friends who provide loving care and assistance to our older people on a daily basis. I say thank you for what you do. As a further commitment of this government to ensuring that our elderly have a voice, an elder care unit was established within the Division of Human Services in October 2018 to assist in providing specialized and committed social services to older people throughout our island. Though small, that unit has done tremendous work to promote the interests and well-being of older people and to honor their efforts and contribution to our country. Our government, through the Division of Human Services and major stakeholders, is also in the process of facilitating a review of the national policy on older people for implementation thereafter. We believe that the establishment of this framework will serve as a useful tool for providing structural support and guidance for our interactions with older people. The government remains committed to working with all partners towards strengthening existing systems and developing new ones to meet various needs as they emerge. However, there is much more to be done, and we cannot and should not stop as long as one older person continues to suffer neglect or abuse of any kind. We must stand united and strong against elder abuse, and each of us must do our part as individuals and as a collective to stop such actions. The message is clear. Elder abuse cannot and will not be tolerated. Of course, the government cannot do it alone. And so, as I close, I urge each person hearing me to take personal responsibility for positive action against elder abuse with your word, your actions, your choices, and your behavior. Let us lend a helping hand to meet the needs of older people. Let us speak up against elderly abuse and report cases that we may be aware of. Let us make a commitment today to communicate respect, to show consideration for the older people, and to treat them with dignity. Today, on World Elder Abuse Awareness Day, and every day, let us stand firm and say no to elder abuse. Let us lift our voices to the awareness of elder abuse. Let us do our part to end all forms of elder abuse. I thank you.
Imagine spending your life taking care of your family, working hard and making your contribution to society. You raise grandchildren as your own. Everybody's needs you would meet. And whoever came to your door, make sure they got something good to eat. And then the time has come, you get old. And gradually people get so distant and cold. All the sacrifices you've made till you reach the end of your years, they're waiting for you to die, to shed their crocodile tears. Getting old is a privilege, so they say. In reality,
And thank you, Minister Montoud, for that message. It's World Elder Abuse Awareness Day. We are discussing creating greater awareness as to what constitutes elder abuse, as well as how we can become an even better society by providing better care for our older persons. In studio with me is Ms. Andrea Alcid, family caseworker with responsibility for the elderly, and Ms. Helen Charles of HelpAge St. Lucia and the National Council for Older Persons. Again, we continue our discussion. Ms. Charles, I think you have all your notes in front of you. I know you have a lot more to share with us with our responsibility to our elder persons.
One of the I'm sure you all heard about the minister's address that talk about sexual abuse. Most times our elderly folks are being sexually abused, and sometimes they do not report it because they're so ashamed, but sometimes they do report it. What I am saying is we must not forget the hands that raise us, whether it is your mother or whether the person is not related to us. We need to make sure that we respect those persons because they are the foundation of our land. And another thing that I want to inform St. Lucia again, we must not forget that regardless of your age, we're supposed to be treated justly, and we are full members of the community. We are the solution. And if we notice that someone in our community is in immediate danger, we should report it to the police, human services, HelpAge, or even prominent persons in the community, somebody you can trust. And sometimes the elderly are being abused by their own family members, and they're afraid to report that they're being abused because they feel if I report it, the abuser will abuse them even more. Mm-hmm. So these are some of the situations that we deal with when it comes to elderly abuse. And sometimes persons know that the elderly are being abused, but they tell you it is not my business. What I'm trying to encourage all of us in different communities, elderly abuse is everybody's business. It is our responsibility. What we are trying to, the message we are trying to send out to St. Lucia and the whole world is to be an elderly keeper, because we're trying to get the community to take hold of, make sure that you are responsible for the elderly in your community. Mm-hmm. I know there are some communities that does that because they have community groups that sees about the elderly within the community. Mm-hmm. We encourage those persons, and we want more individuals to do that. Another thing that we are trying to do, there are some needy older persons that really need help, and we are trying our best to make sure that those persons are being taken care of. We're trying to see if we can have soup kitchen for make sure, especially those elderly persons, that the caregivers are taking care of them Monday to Friday. But you find Saturday and Sunday they don't get a hot meal. So we're trying to ensure that those persons have been taken care of. We're in the process of having 2 soup kitchens, one in Dennery and one in Ancillary. The reason for that, we had need assessment in these 2 communities. We are not able to do the whole island. You start with a number because you have to start somewhere. And maybe as time goes by, we might have more soup kitchens within the community, or maybe if there is a group within the community that want to do that, we're going to give them all the support that is needed.
Okay, all right. Physical, sexual, and emotional abuse, Andrea, among the abuse for the elderly, you also have neglect and financial. How do we prevent this?
We can try to prevent it. For older persons, we say keep regular contact with your friends and family, say what's been going on, say what's been happening, say what's affecting you. We try to encourage the older persons to know their rights, because everybody has rights. Children, older persons, middle-aged persons know their rights. We ask them to think about their plans, what they want to be done, how they would like to be treated. We also ask them to ensure that their legal, financial, and other matters are in order, particularly for some persons who are financially able. We say to you, speak to your family, speak to whoever is responsible for your finances. Let them know what you want to do, what you don't want to do, so in that way you're not being abused in any way. If you know an older person, we say encourage your older person to seek support if something is happening with them. We say spend quality time with your older person. Tell them about their rights for those who don't know about their rights. We ask you to encourage them to participate in activities. I remember growing up when they had the La Rose and Marguerite festivals. We find a lot of older persons going to the community center to the various festivals. In some communities, they still have daycares and other activities that older persons can attend. We ask you to take them. Take them if you can, make the time to take them, make the time to go for walks with them, make the time to just talk to them about what's going on, because you find when you speak to an older person, you spend time with them, they tell you certain things that has happened to them in recent times that you never even had the inclination of. And we ask you to educate yourself about the needs of older persons, educate yourself about what's going on with them. So in that way, you're in a better position to help. You're in a better position to know which resources you can tap in to assist those older persons. And one also important thing we want persons to do, particularly for our older persons who suffer from dementia and Alzheimer's, we ask you to do the spot checks. Look around. If you're the one doing the showering or the cleaning, see where they're most sensitive, because like Ms. Charles mentioned a while ago, we have older persons being sexually abused and it's not reported. And it could be for a very simple reason that they're just not aware that this the really terrible act has happened because of the mental health challenges. So we tell you, do your spot checks, find out what's going on, be very observant, be vigilant, and make sure that you do whatever you can to prevent your older persons from being abused, neglected, physically, sexually, emotionally, and financially.
Okay, and for help, information, and support,
for help, you contact the Division of Human Services at 468-5360 or 454-8802. That's in the Viewford office and the Castries office. HelpAge St. Lucia at 4516285. The Vulnerable Persons Unit at 4564051 or 52, or the SSDF Home Care Service at 4526699. Anybody there you call at any time during working hours can assist you, can direct you, will go and, I wouldn't say investigate, but will assist as best as possible to channel the response that's needed.
Okay. Final word from you, Ms. Charles?
Moi, je veux crier à sujet cette lycée. Moi, quand je dis pas toi, je veux crier à sujet cette lycée. Je dis c'est World Prevention of the Abuse. Moi, je veux crier à sujet cette lycée pour nous, pour que gros monde, maman nous et puis papa nous, puisque c'est eux qui fait nous. Nous pas ni pour oublier, c'est les nous fêtes. C'est eux qui lever nous, c'est eux qui ban nous, ça nous, je dis ça nous y est, et ça c'est eux qui bâtit cette lycée et puis mettez nous côté nous y est. So moi j'ai à sujet cette lycée pour plus mais que maman et puis papa, because even at the Bible do, so pour que maman et puis papa ou vivre plus longtemps. So c'est ça c'est Marshall Salah m'a crié by tout le monde. Avec garder ces signes, peut-être ou pas ça qui signe ces mona venir yo abuser nous n'est pour garder pour
Gardez ces différents signes.
Gardez différents signes, c'est mon année. Comme Miss Alcide dit, de laisser gros mon année dimension avec Alzheimer. Si vous ne savez pas qui ça y est, nous ni office c'est limo Miss Alcide là. Vous pouvez créer et vous pouvez jouer toute information au besoin. Parce que de là nous dit que ça c'est gros mon, c'est mauvais, vous savez ça yo fait. Et de là yo pas même savent ça yo. So, si vous voulez pièce information, puisque nous savons toute information au besoin à sous ces maladies, c'est une maladie qui est bien sérieuse et nous sommes pour garder, puisqu'il n'y a pas de oui, mais si vous jouez une bonne, peut-être ça fait un bagage, vous pouvez connaître, et bien vous pouvez connaître ça pour faire. Et manière pour dire et puis c'est quoi mon nom. Merci.
Okay. Merci Appeal, Ms. Charles. Thank you, Ms. Andrea Alcide, family caseworker, for sharing some valuable information here with us today as we've been discussing elder care and the awareness of the abuse of elder persons. Thank you, St. Lucia, for staying with us again today, and a reminder that although the curfew time has now been reduced, we ask you to obey the protocols and ensure that everything you do is well within the stated guidelines as well as the law. That's it for me today, and do continue to remain safe. I leave you with this song from Snow, the winner of the 2018 Intercommercial House Calypso competition. The song is called Getting Old. Have a good one, St. Lucia.
Just imagine spending your life taking care of your family, working hard and making your contribution to society. You raise grandchildren as your own. Everybody's needs you would meet. And whoever came to your door, make sure they got something good to eat. And then the time has come, you get old. And gradually people get so distant and cold. All the sacrifices you've made till you reach the end of your years, they're waiting for you to die, to shed their crocodile tears. Getting old is a privilege, so they say. In reality, most of us suffer and waste away. And despite all the good you've done, no one shows appreciation. Debut vie, your family, c'est j'étais wa sous côté. I'm nobody's child, nobody's child. Debut vie, your family, c'est j'étais wa sous côté. Guys, up! A message from the old to the young.